November is dedicated to lung and pancreas cancer awareness, and here to tell us more about how Austin CyberKnife can help in the treatment of those is radiation oncologist and medical director Dr. Doug Rivera. Hi, doctor. How are you? Thanks for being here today. We appreciate it, as always. So tell us why it's so important to have a month dedicated to these types of cancers and what the statistics are on these two in particular.
Right. So, having a kind of a designated awareness month really allows us to kind of focus in on those things, really make people more educated on the process, and therefore allow them to learn about the ways to prevent it and or get treated for it. So the thing about lung cancer and pancreas cancer is such really deadly cancers. Lung cancer in particular, although very common, second and third, it's really the number of people who die from the cancer that's so outstanding. I mean, it's about 20% of all lung cancers deaths. So if you look at lung cancer in particular, if you combine breast cancer, prostate cancer, and colon cancer, and all the people that die from that each year, lung cancer actually is more than that.
Wow.
So 1 in 4 people who die of cancer will die of lung cancer. It's a huge problem. Now, largely it's a preventable disease, and what I mean by that is that it's not very common in people who don't smoke. As people have started to decrease the smoking usage, it's actually starting to decline. Over the decades, we've actually made increases in terms of people who survive from it, fortunately. But a lot of that's going to be coming from screening, and a recent trial came out looking at screening in particular. So those patients are really at high risk for it, meaning they have smoked for a long period of time, over the age of 55. Now recommendations for those high-risk patients are for screening because it does help them beat cancer.
What are the benefits of CyberKnife treatment for these kinds of cancers?
So CyberKnife is a very kind of unique treatment in the sense that it does replace in a lot of ways traditional radiation machines or even surgical options in some cases. It's an alternative to that. It's a very painless, very focused way to deliver treatment, and by doing so, patients are able to kind of get treatment also very quickly. Usually 3 treatments, 1 treatment, sometimes, or even not more than 5 treatments.
Wow.
They can drive themselves, to their treatments and even drive themselves home afterwards.
Really keeps their independence intact and their mobility and abilities intact while they're getting this treatment.
Right.
So we would just call you for a consult, or how would we be referred to you, or would we start with you if we were diagnosed?
Either would be fine. A lot of times the physicians will be making some referrals, and or people who would like to learn more can certainly call the center as well.
Awesome.
And be seen by a physician.
Thank you so much. We appreciate your time very much.
Thank you.
And Austin CyberKnife is located on I-35. Call them at 512-324-8060 or go to austincyberknife.com.